my goodness. We are here. We made it. We finally nailed down a date and here we are. So welcome Christa and Heather to my podcast, The Illuminated Darkroom, Conversations on Breast Health and Beyond with me. Thank you for being here.
Thanks for having us.
Yeah, thank you.
And this is my first in-person podcast. So this is a different vibe.
Yeah, it's nice.
Yeah.
Krista is one of my mammography technologists, and Heather and Krista are best friends. I think your stories are quite interesting, how you met and how your experiences have influenced what you do and your relationship till today. So I'm going to start with you, Krista. You were born and raised in Calgary, yeah?
Yep, I'm from Calgary.
Okay, so I want to ask you, what led you to healthcare, radiology, and then specifically to breast imaging as a part of radiology?
So I always knew I wanted to go into healthcare, but I didn't really know what I wanted to do. So when I was in grade 11, I got introduced to something called Careers the Next Generation, and it allowed you to do a summer internship. So my first summer was at the old Children's Hospital, and it no longer exists, I think. It's right? They don't.
I have no idea.
Yeah, it's now Richmond.
I know they have the colorful
It's
building
like a
now.
diagnostic
So it's like
center
the
now.
older
Oh,
building.
okay. Way back when.
Regardless,
Yeah.
I was in the CAS clinic, so I worked with radiologists, orthopedic surgeons, and I worked with technologists who did casting and serial casting and worked with broken bones and tons of different stuff with kids.
This is as a volunteer?
It was an internship. I got
cool.
paid. I got paid minimum wage.
Oh, wow.
But I got paid.
That's cool.
And you got to do it for the entire summer.
That's awesome.
And then the second year, so when I graduated grade 12, they allowed me to do a second year. And that year was at Peter Lougheed. And it was in all of diagnostics. So I got to see MRI, CT, X-ray. I got to go into angio suites. I got to see nuclear medicine, kind of everything. But I never really asked how to get into any of those fields. So I just went the path that everyone talks about. I went straight to university.
Okay.
So
you would have been how old about that time?
17 when I got into university.
Oh, young.
I think just about 18.
Okay, cool.
Yep. And then went into biological sciences and still struggled to find my groove. Went into zoology. I liked that a lot more. Wanted a GPA booster. Went into Italian. I'm Italian, so it was a no-brainer. I finished my degree and was like, now what? What's next?
Yeah.
I knew I wasn't really wanting to do nursing. And I think doing the diagnostics, I knew I loved imaging. I knew I loved patient care. So I went to SAIT and I got in right away.
Oh, neat.
Yep.
So you went to university, you did an internship, you went to university, and then you went to SAIT.
Yeah, so I did a 5-year degree. I did a double degree.
Wow.
First, and then went to SAIT. Yep.
Okay. Well, that explains a lot. In a good way. In a really good way. Awesome. Okay. And then how did you segue into breast imaging as a mammotech specifically?
So when I graduated from SAIT, there were almost no jobs in the hospitals for X-ray technologists.
Okay.
It was kind of, if you found a job, you were very fortunate. And I got lucky and got into a clinic setting right away.
Okay.
So hospital techs don't often go into mammography because there's not many hospitals that do mammography. Clinic techs, you tend to go more into bone density, mammography, fluoroscopy. Within only a few months of working, one of the radiologists and my manager at the time said they thought I had an old soul. They thought I would be a really good fit for mammography. And
I would agree.
Yeah. And I took the course and it was like, for me, it was like an instant connection. I connected with my patients. I really loved it. I don't even know why. Like I can't explain what it is about breast imaging and mammography that I love, but it's very rewarding. Yeah, it was just like the perfect fit.
Yeah. And I know, well, you're an empathetic person, so it just, that field literally calls for it. Yeah. Awesome. Well, that's good to know. Interesting. See, I didn't know that.
Yeah.
And Heather, you were born in Calgary as well.
Yes.
You've got Calgarians here.
It's rare.
I know, it is rare.
I was born in Saskatchewan, so I'm not even from Alberta. But anyway, how did you get your vet?
Yes.
How did you get to practicing vet medicine, and what led you to that?
I kind of did the same thing Krista did, as I thought I wanted to be in medicine and I wanted to go along that path. So just went into biology, zoology, and did my, I don't want to say GPA booster for me, but primatology as well, just to mix things up. And like every time I could try to expose myself to medicine and try to figure out where I fit in there, it just didn't quite click.
Okay.
And then I actually had a colleague at one of my jobs that mentioned, they're like, oh, my cousin works at a vet clinic. How would you like to volunteer there? So I was looking for volunteer hours, trying to spread things out. And I was hooked. It was great. It was medicine. It was hands-on. It was working with animals. And I probably also helped that I loved the clinic that I was at. And there was no looking back. It was all geared towards vet school after that.
Cool. And I know there are not too many vet schools. I know there's one at you in Saskatchewan. There's one here too.
Yes.
Is it?
Yes. So I was the 5th graduating class at the University of Calgary.
Oh, wow. So how did you two meet? Your best friends, how'd you meet?
Do you want to tell?
Sure. We met at a summer job at our W&Co at Chinook. Yeah.
Your W and Co?
RW. It's a
it's a clothing store.
Yeah.
Yeah. Okay. I was actually going to ask you what a GPA booster, because I'm sure the listeners know that. I should probably know what that is, but
it's just to help get your grade point average up,
okay,
so that it looks better on
okay.
transcripts.
Okay, got it. So you both were working at RW and Co?
Yeah.
Okay.
So just before I went to go do a study abroad in Europe, I decided to get a little job. So I was working retail, and that's when I met Heather.
That was my summer job before starting university.
Yeah.
And then first day of classes in university, I think it might have been anthropology. Yeah.
Yep.
I saw her and she was the only person out of 200-300 person class that I recognized. And we sat together and
it's history.
Yeah.
The rest is history. Yeah. You have been friends for a long time. So, and I know that you both have families. You're both moms and wives. So tell me a bit about your families.
I have 2 boys, 8-year-old and a 6-year-old.
Okay, you're busy.
And then I have a husband as well. His name's Jim.
I've met Jim.
Yeah. Being a boy mom is a huge adventure. It's constant. It never stops.
Okay, I'm interested to know, do you have 2 boys too?
No, I have a boy and a girl.
Okay.
Yeah, so I have a 4-year-old boy and a 2-year-old girl. Birthdays
4 and 2
next weekend.
Okay.
Yeah.
Interesting. Very different?
Oh, extremely different. Yeah.
So very different. Yeah. I have 2 girls, so I know nothing about
we have the perfect
the
combo.
boy situation.
2 girls, 2 boys, a boy and a girl.
Yeah. Well, there you go. So how did you meet your spouses?
Oh, well, my story is interesting, I guess.
Yes, it is.
So my husband is my uncle's wife's brother, which sounds really odd.
Well, I'll try not to think too hard about it.
Don't think too hard about it. So I met him when we were really young, before my uncle married his now wife.
Okay.
So we knew each other since we were 12, but obviously weren't in each other's lives for most of it. And then kept bumping into each other. Then obviously through family events, we saw each other and, on and off kind of dated. And then the rest was kind of history. Yeah.
Okay, cool. And Heather, how did you meet your husband?
Well, I have Christa to thank for that, actually.
Yeah, okay.
My husband, James, his best friend lived next door to Christa.
Your husband's best friend.
Yeah.
Okay.
So they would hang out and they had gotten to know each other and had been at several parties together. And I didn't mention my history. I was in Guelph. I had started a master's before a vet school, and I came back for Christmas, and Krista's like, "Oh, I'm going to invite you out, and my neighbor's going to bring some friends."
Yeah, I knew.
You just knew, right?
I knew. Because I knew him first, before Heather, and then I was friends with Heather, and I was like, they just have something. Yeah. I had a feeling that they would just connect or click. Yeah, I said, well, what's the worst that's going to happen? We'll have a fun evening.
Oh, that's awesome. Yep. That's so cool.
Yeah.
And how old were you when you met? Yeah, you're
23.
You were 23 when you met him. Okay. Somewhat unique about you is that you were diagnosed with breast cancer in your 20s.
Yes.
At what age in particular?
23.
Okay, yeah. 23 when you met now husband, right?
Weeks before.
Yeah, literally.
Just before.
Yeah.
Okay, that's interesting. And before we get into this talk, I want to first of all say thank you for doing this. It's we often think of breast cancer and we think of people that are older or midlife, and there's a lot of attention now on that and, with the guidelines and all that. And breast cancer does occur in young people, and it maybe doesn't get as much attention as it should get. And the challenges that young people get are somewhat different from older ones, right? And it's hard to talk about. There's a vulnerability to it. And so there's definitely a lot to learn from your journey. And I want to thank you for being here and doing this.
No problem.
Okay, awesome. Okay. So how did you first discover that you had breast cancer, and what led you to seeking medical attention?
Yeah. So I honestly, the underwear on my bra was bothering me one day, and I felt in that general area and I felt a lump.
Okay.
It was really small, and my memory remembers it as something pea-sized, maximum marble sized. And I was like, this is weird. This is probably not something I have to worry about.
Okay.
I'll sit on it for a week or two. I was also newly moved to Guelph in a different province. I didn't know anyone there. So I was like, maybe this will just ride out. And then when it hadn't gone away, I had the fun task of finding a doctor in a city that I was new to, or a town I was new to. And then I'm thankful that they took me seriously, because I essentially went to a doctor at the university that is mostly seeing young 20-year-olds. So this isn't something that's typical or comes up. But they referred me for an ultrasound right away, and there was concerns there. And I ended up having a biopsy as well.
Did you get a mammogram when you were 23?
No.
Okay, so this is interesting. So when you saw the doctor, did they do a breast exam?
They did.
They did?
Yeah.
Okay. And then they sent you for an ultrasound?
Yes.
And then you had the ultrasound? And how did that whole process go? Who talked to you about it? How was the explanation of the...
Yeah, the original doctor that referred me talked to me about it after, and they said, you're young, there's still signs that this could be a cyst, or this could be something completely benign, but they weren't comfortable with the ambiguity. And I was willing to have additional procedures like a biopsy. I was comfortable with that. So they arranged that for me.
Okay.
Yeah.
And you were by yourself, no family in Guelph?
Yes, I was by myself. Yeah, there was, I got to come home between the ultrasound and the biopsy over Christmas.
Yeah, and that's when we were together.
Yeah.
Okay.
And that's when she met her now husband.
Yes,
Okay.
in between the ultrasound and the biopsy. And then I came back for school, first week back for the winter semester. I had my biopsy. So I was back in Guelph for all of 2 weeks before I came home.
Oh my goodness. Okay. Yeah. So you found this in, Christa, you're in mammography, right?
Oh yeah, she told me right away.
Okay. And what are you thinking?
When she described, I actually remember, it's weird how much I remember because it was a phone call. She's like, I felt something, it felt like a pea. And I remember when I was training in mammography, one of the things they tell us is if it's hard and it feels like a pea and it's not super mobile, often it's not great. So the whole time it was like always in the back of my head, like this might not be good, but I didn't want to scare her. So I don't remember if I said anything. I think I just kept it to myself and was hopeful, but I was like, I don't want anything I say to make any impact. I want to make sure that it's just like her journey. And then when she came home, like we just enjoyed ourselves. We had fun. We didn't really think about it. We didn't do much, but it was always here, I'm sure, for her too. Like both of us.
Yeah.
Because when someone's like your sister,
of course,
right, you're connected on kind of a different level.
Yeah. You're pretty calm, because I'd be like, let's go do it now. Let's go check. Yeah.
No, Heather's a calm person. She's supposed to be calm.
Well, that's so good. Okay, so then you went back, you got the biopsy, and it's an interesting question you asked. So you didn't have a mammogram?
No, I didn't.
Ever? Like back then?
Not until screening post-treatment.
Okay. We don't routinely do mammograms in young people, right?
Yeah.
But the way I was taught to my mentors and spoken to some of the surgeons in Edmonton, if you have a patient that comes in with something you think is significant, right? We do a mammogram. It may be initially a limited mammogram, so we might just do MLO views, like 2 views of both sides, just to give an idea of what's going on there, right? So you have the biopsy, you get the results. Who tells you the results?
This is when I knew there was a dark cloud over the situation, I got referred to a surgeon I hadn't seen before to have the information relayed to me.
Okay.
So I did, and they told me to bring someone, so they can't mask it too bad.
So you're telling you, but not really telling you. Yeah. Okay.
Yeah. So I had, luckily by then I had a friend that I had started to make at university that I was like, this is the most awkward and intense situation, but will you come with me? And she'd had a pretty scary medical history herself. So she was like, I'm game, let's go. So I heard the news by myself, but yeah, he was pretty straightforward. And I have to say, I practice like this now too, is like, I don't have good news for you, but this is how we're going to handle it. And we went from there. And the plan was always, I had the option to stay in Guelph, but the access to treatments that I needed required a lot of shuffling around and wasn't necessarily in the city that I was staying in. I had no support. So it was a no-brainer that I just moved back to Calgary right away.
Yeah. Interesting. What was the pathology that you had?
I had oh no, I'm not even be able to say it.
Is it invasive ductal?
Yeah, invasive ductal carcinoma.
Grade 3, I think you had mentioned.
Yeah. We didn't know about, I did actually have lymph node involvement. We didn't know about that until I came to Calgary.
Okay. So how did that, when you say you had lymph node involvement, when they took
metastasis to my lymph node.
Okay. So you had a lymph node dissection.
I did. Yeah. But I didn't know about, actually once I was referred to a surgeon in Calgary, during her exam, she felt a lump in my armpit and sampled it prior to surgery. Okay. So she was able to give me that information, but that was another piece of the puzzle, another surprise.
Yeah, for sure. Okay. So walk me through, you've done the biopsy in Guelph, you're back here now, obviously to take care of things, right? So can you walk me through what happened when you first came, who you saw, how they talked to you about it, how you started your treatments, essentially your story.
Yeah. So I was initially referred to a surgeon at the Breast Health Center at Foothills. And she was kind of walked me through the options. So, did the exams, did any confirmatory testing that I needed. And then I was essentially presented with the two main options of either you have surgery now, and then chemo, or chemo and then surgery.
So
and
neoadjuvant.
Yeah, as a 23-year-old, that the worst thing that I thought that could happen to me was losing my hair and my eyelashes and going through chemo. I was like, I am putting that off for as long as possible. Plus, not having the medical knowledge that I do now, the idea of just getting rid of it. It was like, it was a monster that needed to go, and it needed to be sliced out of me now. And I think there's different ways to approach that, but that's what made sense to me at that stage. So that's what we went with. So I did have surgery first. So I ended up, after all of my screening tests, everything, I had surgery probably about 6 weeks after arriving back in Calgary. Everything moved really quickly for me. They saw that I was 23 and they're pretty much, you get everything tomorrow.
Yeah.
Yes.
So I had surgery, and I had a lumpectomy in my left breast, and then I had a lymph node resection. So they took all my lymph nodes from my left armpit, because there was quite a few lymph nodes involved. So everything went. After recovery from surgery, then chemo started.
Okay. Yeah. So you said a few things that are important. So grade 3, when we look at cancers, we look at the grades, it's grade 1, 2, and 3. And when you generally have cancers that involve young people, it tends to be more aggressive. So grade 3. And it spread to your lymph nodes. So they did a dissection and took most of them out. And where were you in all this? How were you?
I just kind of let Heather lead the way. I didn't want to be that friend who was like, only talked about what was going on. So I tried some distraction techniques. We did lots of just hanging out and spending time together. I definitely bought her makeup. I bought her whatever she needed.
The girl stuff. The girl stuff.
Anything to make her feel like beautiful, because I know I'm going to cry. I knew she was struggling as a 23-year-old to lose her hair.
Yeah.
So it was like, what do you need? You want eyelashes? I'll buy you anything you want.
Yeah. Aw. Well, that's,
So, you checked in on me minimum once a week.
Yeah.
Absolute minimum.
Yeah.
That's nice.
Yeah. But honestly, I didn't want it to define her at that stage. And I wasn't much old. Like, I'm older than Heather by a few years, but I just thought, I want to come and visit you and see you. And I want to spend time, and let's let's read a book, let's watch a movie, let's hang out, let's go for a walk, let's
Let's live life.
live life
Mm-hmm.
as best as we could. Like,
Yeah.
she didn't feel great. Sometimes she'd get really hot. I don't know if you want to talk about the hot flashes, but she was going through a lot, like hormonal changes. And so it was a lot of just kind of chill. Like, we didn't need to do much. It was just, I always wanted her to know you're not alone.
That's so important.
But I also didn't want to be the friend who was like, so how are you feeling now? And how are you feeling now? I wanted her to be able to, if she wanted to talk about it, to talk about it. But if she didn't want to, that's fine. Let's talk about other stuff.
I got the sense that you're super chill.
I had my moments. I'm task oriented, and I just saw this as a task.
Yeah.
For a lot of it, like that kind of, not that I wasn't emotional, not that I didn't have to feel things, but I had my list of appointments, I had my list of medications, and this was another project to me. This was another something I had to get done.
Yeah. So when they told you your diagnosis, did you hear it?
I did. I didn't. That's a good question, because you understand that, but you're like, this is so foreign. This doesn't happen to people I know, especially not me. Like it was, and just the situation I was in, like nothing about my situation when I found out was me. Everything was so new. And then there was this giant loophole that was thrown at me.
I'm assuming the Calgary Breast Health Program was around at the time, right?
It was, yeah.
Yeah. And so when we see patients that we are almost certain have cancers, we have to write something in their reports. And now that people can access their reports, they can look at it and see, oh, they come in, oh, you said this. And this is often before they talk to their doctors, right? And sometimes we, say, well, I highly suspect, right? And people want to know, but they don't hear it. And that is very normal reaction, right? Like we just know, what'd you say again? And so I just kind of wondered how that worked out for you.
Yeah, it was, I don't know.
Was it overwhelming, do you think?
It was, 'cause I didn't know what to think.
Yeah.
And I know me, less so was I thinking about the diagnosis, and I feel like my brain, out of defensiveness, was like, thought of logistics right away. I'm just like, so what do I have to do now? How am I going to get home? And there was just, I don't know.
And did your family know too? Like, did you talk to them about it? Do you have sisters?
I told my parents when I found the lump and that I was having diagnostics done. And, just kind of out of protection, there's probably part of me that was like, don't worry, I'm going through the paces. It's going to be fine.
Right.
But yes, pretty much Christa was probably one of the only people that knew prior to an official diagnosis, and then my parents.
Any family history at all?
No, none whatsoever. Not for many generations.
Often the case, right? It's unfortunate because 80 to 85% of people that get breast cancer don't have a family history. And that number always shocks people, right? It is shocking, right? Like, wow, the biggest risks are being a woman and getting older.
Right.
Or sometimes when you're young, right? When you went to see the oncologist, you saw the surgeon first and then you saw the oncologist?
Yes.
So how did that conversation go? How did the process go?
Well, if I'm recalling correctly, I didn't even see my oncologist until after I'd had surgery.
Okay.
Post-operative. I could be mistaken, but I don't think I met with them until then.
Did you go alone?
No, I usually probably had my mom with me most of the time.
Okay.
Yeah. So that, it's also, again, you only hear what you want to hear. So it's always good to have somebody with you. I have to say that there's a lot of information that's laid in front of you, and, it's good to know everything that you're going to run into. You probably only hear about 5% of it.
Yeah.
Or what's going to affect you immediately, or the things that were important to you. So again, as a 23-year-old, it was, what about my hair?
Yeah. Yeah, totally. Hair is important, right? Yeah.
Like, it sounds really superficial, but
it's
at
not.
that stage, I didn't know what was more important than that.
Yeah.
Like,
that's almost part of what makes us female, right?
Yeah.
Women, right? Yeah. And as a young person especially, that is definitely something to worry about. That's real.
Yeah. I have to say, I had a fantastic oncologist that was very, very empathetic and very personable, and was very good at chatting through everything. Still, everything's a surprise the first time. And there was always complications to work through. Like, I had pulmonary emboli, so blood clots in my lungs, partway through chemotherapy. So we had to switch things up to keep that safe for me, and some hiccups there. But for the most part, it was typical chemo.
Yeah, blood clots can be a complication during the chemotherapy process. But so for chemotherapy, how did they explain it to you, or did you kind of have an idea of what that would involve?
Um, I, the day-to-day process was explained to me. There's lots of, at that point, there was lots of books and like pamphlets about the processes and the different chemotherapy options that they might pick for you and why they picked a
Mhm.
certain protocol for me. I recall it being probably more detailed than I probably could comprehend at the time, but I think
Mm,
it's also probably better to have that information and not wish that somebody had told me it later if I hadn't heard it.
yeah, to have like more than and figure out what works for you there, right?
Yeah.
It's hard to say. I asked you that question because someone had mentioned to me that I think they went and they showed them a video about chemo, something about weeds, and she was kind of confused, like, what does this mean?
No, it was for me, it was just very one-on-one, like walking through everything step by step, asking questions as you go.
Okay. And how often did you have to have chemo?
So the protocol I had, it was sort of split into two parts. So the first part, I think it was I was going to have treatments 3 weeks apart, 3 or 4 weeks apart. It was a longer time frame, and there was going to be 3 or 4 of those. I'm reaching back in my memory,
Mm-hmm.
and then there was a portion of my chemotherapy that was going to be weekly. It did get switched around because of my blood clots and
Mm-hmm.
modified slightly. But I think the grand total was going to be 12 treatments.
12 treatments.
Yeah.
Okay. Now, Krista mentioned stuff about hot flashes. So hormone, your tumor was hormone positive, right?
Yes, estrogen positive.
Yeah.
Yeah.
Okay. So then they use some endocrine therapy.
After chemotherapy, it was started. Yeah.
Great.
So the protocol that I was on was picked because I had had blood clots in my lungs. So drugs that they would have picked for someone my age weren't an option because that would have increased my risk of blood clots again. So I was essentially on injections to get me in a perimenopausal state,
At
and then I was
23.
yes, and then I was then taking an oral drug
Mm-hmm.
that women that were already in a perimenopausal state would have
Mm-hmm.
taken. So I had that extra obstacle. And the goal was 5 years. I lasted 4.
Mm.
And then I said that was enough.
Oh.
And then I was told they were surprised I made it that far. And I was,
Interesting. Yeah,
yeah.
I see that. It's interesting you say that because you'll see a patient was supposed to be on this for X amount of years and they only did it for this year,
Mhm.
this amount of years. And it's sometimes easy to judge and be like, oh, they didn't finish their treatment,
Mhm.
right? You went far. What was that like and what made you stop and be like, that's it, even though you know that this is important to, your treatment journey?
It just finally broke me. I just didn't feel the age that I was. Like I
Mhm.
was like I felt dried up and old is essentially I felt like my skin was leathery. I just I didn't feel like a young person in my 20s.
Mhm.
I felt like I was ancient, and it
Mm.
just a lot of this actually happened vet school, and I
Mm.
had 4 years of distraction in vet school, and I finally was like I'm
Mhm.
graduating, I'm ready to live my life. And I'm like, statistically, I wasn't going to gain a whole lot more from that last year.
Yeah.
And I thought about it a lot because I was like, because I wanted to make sure I didn't regret doing it
Mhm.
if, say, breast cancer ever came back. And I was like, what
Mhm.
if that 1 year solved that for me?
Right.
And I got to the point where I would rather be me
Right.
than gain that extra 5-10%
Mhm.
Yeah.
likelihood that I wasn't going to get breast cancer again.
Yeah. You can say.
Because I remember we'd be going for like dinners or lunches and she'd be having like crazy hot flashes and it would start like on her lip.
Oh,
Mhm.
You just starts like sweating. And
yeah.
I remember one time we were having lunch and she starts crying. I'm like, are you okay? She's like, I don't want to go through menopause
Oh,
in
yeah.
my 20s. And it hit me like, man, this girl's not only going through treatments and dealing with like everything she's going through, she now feels like she's going through menopause in her 20s.
Mm.
And then there's no one to relate to, right? Like,
Yeah.
I'm not feeling that way. Most of her friends were all in our 20s or early 30s, aren't feeling
Mhm.
that way. I totally empathize. Like,
Yeah.
she just wanted to feel young and vibrant again.
And
Heather is also an inspiration to a lot of people because if you heard her say she hadn't gone into vet school yet.
Yes.
So she applied and interviewed while she was going through all of this, and she blew them out of the water and showed them how crazy smart she is and determined and how she can do this. Going through treatments, like some people think, okay, I'm going through treatments, my life stops, or my life revolves around my treatment. I want people who hear this to know, like, you can be a Heather. You can work hard and focus and find a distraction and prove to everyone else and to yourself, maybe, this isn't me. This is part of my journey, but this isn't who I am.
Doesn't define you. Yeah.
I remember us talking about her interviews, like, do I wear a wig? Right? And you wanted.
Oh no, I wasn't there yet. I had just had surgery.
Oh, had surgery. That's right.
I had surgery, and then probably about 5 days before my first chemo treatment, I had the interviews.
That's right.
Yeah.
Yeah.
Which I think also helped, because I was in a little bit of a, I'm going to say what I think, I'm going to say what I mean, because if this happens to be a year I don't get in, oh well. So I went all in, and I probably was more frank and more honest than I would have been otherwise.
I'm glad you said that, because it is so true. Because at that age, my goodness, like your life it's starting, and then this, and some people think this is it, it's over, right? And for you to have that diagnosis, go through this, come on the other side of it, like that, that is amazing for people to hear that and know that this is not, it's not the end. You can still move forward and achieve things in your life. Yeah. I love that. You had met your boyfriend at the time.
Yeah.
You met him just before you were diagnosed.
Exactly. Yeah.
Okay. So how did that conversation occur, if it did, at that time?
Well, I didn't have that conversation. I made Christa have that conversation.
Oh, really?
Honestly, at the time, she actually knew him better than I did.
Really? Okay.
And just what my brain thought of at the moment when I found out, because I was telling my family, telling my close friends what was going on after I found out. Because I think I'm not a person, I'd rather just, as soon as I found out, I just called everybody.
Yeah.
That was what felt right to me. I just had to repeat it 10 different times, and then it was going to set in. But I'm like, I don't know what to tell, because we weren't officially dating. We had just met, and
this is amazing.
Had been messaging each other, because there was the reality of we weren't in the same city at the same time.
Right.
And I called Christa, and I was like, I don't know what to say to him. I don't know what to do. So can you do it?
So what did you do?
I just had a really honest conversation and said, hey, this is what's going on. So at first I think I said something along the lines of, if Heather's distant or something's going on, this is what's going on in her life. Mm-hmm. If you want to try and get to know her, like, go for it. But if this is too heavy for you, let her know, be honest with her. And the whole time he was like, no, like, I'll help her. I'll be with her. But he's a very calm person as well.
Yes.
They're both calm people. And he wasn't shocked by it, in the sense, like, he wasn't like, oh my, that's it, I'm done. He took in the information. We had a really heart-to-heart conversation. I'm pretty sure I threatened him at some point. She's my best friend. You don't hurt her.
Yeah, okay. Yeah.
As a protective best friend.
Of course.
Yeah.
But, Heather and I had a lot of conversations afterwards, like, because they were so new, things about our bodies and just how life would feel, how we would feel about our own self, right? And dating, because neither of us were married at the time. So, I mean, the nice thing is that Heather and I are willing to have very open conversations about stuff. And I think it helps us talk through things and navigate life a little bit. So I don't know if you want to discuss any of what we talked about, but regardless, it was, he did know, and he stuck it out. And
that is really incredible. I want to know a little bit more about him. People want to know, because, this is, I think it's really important, because this is one of the challenges that young people face. Some of the young people I've talked to, they don't want even their boyfriends at the time to know about it, or they worry about what's going to happen in the future. And I want people to know that there are people out there that are solid and will be right by you there. It's not over, right? And but at the same time, you're also looking for certain qualities in a person. Like, what is it? I want to hear about him, like a little bit more about him, if you don't mind.
Once he decides to love you, he's he's in. Like he's extremely loyal. And for him, he didn't see me as someone with cancer. It was just this new girl that he wanted to get to know. And if anything, if anyone was going to run away because they were nervous, it was probably me. Because I was like, this is too much. Like, I don't know what to do. And we actually spent a lot of time. We probably spent more time together because of my diagnosis and the free time that I had. Free time in quotation marks, because I was addicted to school and work, and I, plans were not easily made. And he's also the kind of person that was just good to hang out. Like he was, if we needed to sit and watch movies all weekend because that's what I could manage, he was good with it. We made do with it. And
did he ask questions?
He did, as far as I was comfortable answering. And he let me just naturally tell him what I wanted him to know as I felt comfortable telling him.
And it was good. Yeah.
Yeah.
I'm curious as to what did he ask, like initially? So you kind of think you're going through this dating process. What do you think the other person would want to know?
To be honest, I don't think he never really asked in-depth questions other than, what do you want me to know? Okay. What do you feel comfortable with me knowing?
Did he come with you to any of your treatments?
He did once. It was, he's not, a lot of my family friends, not everyone's into needles, things like that. So he didn't come to most of them with me because it was also a comfort level thing, even though everything was going well. To me, that was one of the more vulnerable moments.
Yeah.
He saw me after when I was sick and I wasn't feeling well and I couldn't keep my eyes open. So, and that was vulnerable enough. So the actually receiving chemo was, I think, a bit too much for me at that time to have him around. Yeah.
And how soon after that did you guys get married? Like, what's the time interval?
5 years.
Okay.
Yeah.
Yeah. I love
after
that.
I finished vet school.
You finished all that. Okay.
Yeah.
Well, I'm going to leave you alone for a little bit, Heather, and switch to Christa. So, Christa, you're a mammotech.
Yep.
And I know you just had your first mammo.
I did.
You just did. So how did it feel to experience a mammogram from the patient's perspective?
So definitely I was nervous. I was nervous to get my mammogram, and I've done thousands of women's mammograms. And so I knew the process, I knew the equipment, I knew what the technologist was going to ask, and yet I was nervous. I think for me, I was nervous about a bunch of factors. Like, I don't know my own breast density, which we can talk about later. So I was curious about how dense my breasts were. I was nervous that somebody I knew, because being a mammographer in this city for a long time, I know people in multiple clinics, multiple facilities. So no matter where I went, essentially, I feel like somebody I knew was going to do my exam. So I guess that added a layer of anxiety. What if they found something while I'm in the room with them? Would they be able to not say anything? And then as a woman, even I was trying to help them position me, even though I knew better.
It's okay. Even I do that now. I'm just like, right
That's
here,
what
right?
you do, right? Yeah.
But I was very comfortable. Like, I took my gown off. I'm not a shy person. I did find it was more uncomfortable than I was anticipating. Like,
really?
Yeah, I knew it was going to be a bit uncomfortable, but definitely where my body habit is, like, my ribs stick out a bit more.
Yeah.
So I found my ribs were kind of getting in the way. I had to relax and remind myself to relax, but it was so quick.
Yeah, it's so quick, right?
Quick.
Yeah, that's interesting you say that, because when I had my last mammogram, and honestly, every time I have it, I'm like, the last one I drove off, and then I came back and I took my husband because I was like hyperventilating, And I say this because it's real. Like, there's, even though we do this day in and day out, it is real. We understand that people are going to be nervous. And as mammotechs, you guys are, like, you're excellent at dealing with that.
Yeah, and I think in the back of my mind, I've seen baseline mammograms that have something. So when it's your first mammogram, it's always there. It's just, is there something? Is this normal? I can't feel anything, but as we know, you don't often feel anything, right? If there is something growing in there. So that was in the back of my head, but I felt so safe. Like, the machines are really, they're good. I felt good. I knew the person, the place. I felt comfortable. I felt safe. And I'm glad I started at 40. Like, I'm not ashamed to say I'm in the 40 club. And I wanted to start right at 40. And I did ask my doctor for a requisition And she was gung-ho. She said,
She
let's
was
do
good. There was
Yeah.
no like trying to talk you out of it.
No, she knows my profession. So I think that helped me.
Yeah.
But I didn't have to fight for it at all.
Yeah. Which is good because that's not unfortunately the same for a lot of women out there, and they have to try and fight for that, right?
Yeah.
And so having gone through this as a patient, how's that made you like look at patients? Has it made you be more empathetic? You're super empathetic.
I actually, now I ask a couple more questions than I wouldn't have before. I ask if the skin or if their ribs are feeling caught so that I can actually smooth that skin out without compromising the image, because that did bother me. It was kind of irritating. And I never thought to ask that before. The other thing is I now acknowledge how they're feeling. Like, you know, it's normal to feel a bit anxious. Let me know if there's anything I can do to make you more comfortable. Just, I want them to realize, I've even said to a few, hey, I've had this too. So that's changed how I can talk to people. Before, I had never actually had a full mammogram. I've been in the machine. We kind of practice on each other, but we don't take a full, like it's not exactly the same. You feel vulnerable.
Yeah, for sure. There's nothing like actually going through an experience to really be able to empathize. And that's what makes it also hard for patients. Like, you've gone through this. Chris and I deal with it day in, day out, but we've never been through it. So we'll never be able to understand what it's like to walk in your shoes, right? We do our best, but we can never, So we keep going and life keeps going. Fast forward, you've got, you had your kids.
Not quite. Well, I guess one important thing to note is that I did have radiation as well that we had mentioned with the first time around.
Okay.
So everyone has the complete story. That I started at the same time as vet school. Not recommended, but I did it.
Oh, wow.
You're more tired. You think it's something that you just go through, but I don't think they stress how tired you get.
Yeah, I was going to say, how did you feel like after each radiation?
The first couple weeks were okay, but it exhausted. There's just a weight over you and you're just exhausted all the time. And that was hard for me because I was in an intensive program. And the first couple of weeks there's some leeway, but then once you're a month in, you're studying anatomy that is just nonstop. There's tests coming up and it started to get really intense.
As a young person, what kind of options were discussed with you in terms of after reconstruction? Yes, no, did you care?
Not really much about reconstruction because with the lumpectomy that I had, I didn't have any extreme defects.
Okay.
My cancer was more on the side of my breast. Okay. So I didn't have any, most of my scars you didn't see them unless I was
nice.
Fully without a bra. And there wasn't a terrible asymmetry at the time. So it was something that I didn't feel like I needed any additional procedures.
Okay.
I was normal enough, I guess you'd say.
Yeah. You were happy with where you were.
Yeah.
Okay. And what were you told in terms of what to expect for the future, in terms of your follow-up, imaging, recurrence?
So with recurrence, the general consensus is probably not any time while you're still young, statistically, which was kind of really foreshadowing. And just a lot of it was based on the imaging that would be followed up with. So the first time around, the decision was made that I would be having mammograms yearly.
Okay.
But because I was young and I had quite dense breast tissue and the images weren't the quality that they wanted for screening, that would be every year I'd also have an MRI.
Okay.
So
they're 6 months apart.
They're 6 months apart.
6 months
so
apart,
every
so we
6
can
months
look
I
at
have screening.
Yeah, and that's pretty typical. Like if you're a bit high risk. Did somebody do a risk assessment on you by any chance?
Not that I can recall.
No?
No.
Okay. How about genetic testing?
I had about as thorough genetic testing as they could offer at that time. It was through the Children's Hospital where I believe a lot of the genetic testing is done. And I was negative across the board for every gene that they tested for.
Yeah, interesting. So we move along and you are 32. And what happens?
32, and about 2 months after I had my first baby, I was breastfeeding just on the one side, because the side I'd had breast cancer on before had been radiated, so that was a no-go. So I was given it a shot. I was breastfeeding, and I was having trouble with clogged milk ducts. So having a lumpy, bumpy breast was not unheard of, but I had one in one spot that didn't seem to want to go away. And it wasn't painful in the same way that a clogged duct was. It was different. And ironically, I was actually due for an MRI probably about 3 weeks later, as part of my screening. It was during COVID. It was 2020. So it was during COVID. So it was hard. All of my screening had been put off and I was pregnant. So certain screenings couldn't be done. So I was out of rotation. So it was planned for 3 weeks later. So I still went to my GP and said, hey, this is going on. I know I have screening coming up, but this doesn't feel right. And because the screening was in with a reasonable time frame, we just went ahead with that. So I had an breast MRI, and it did essentially light up like a Christmas tree in one spot, as well as some lymph nodes in my right armpit as well.
So this is the same side?
Opposite side.
The other side.
Other side. Yeah.
Wow.
So so that was fun being a new mom, having a couple month old baby and
COVID.
And COVID.
And
yes.
COVID and that.
Yeah. So I had breast cancer again. So again, I was referred to the same surgeon, which was wonderful. And the options were laid out for me, but they're laid out a little bit differently, or I heard them differently. It's probably a mix of both. But there was do you do surgery first or do you do chemo first, and weighing the pros and cons. And I do remember having similar pros and cons presented to me before, but I heard them differently this time for sure. And I also feel like maybe the direction that I was being pushed in was probably a little bit different as well. In that I chose chemo first this time. And the reasoning behind that is I get now, also having the background that I have, having had cancer before, and although veterinary medicine isn't the same, it makes sense to have chemo first because you can visibly see if it's working on those cancer cells. If you see a shrinking of a tumor, it's working. Whereas if you've already cut that tumor out, you don't know if it's working on those few cells that are left. So, now that I could use logic a little bit more, and it wasn't as an emotional decision for me, it made sense. And then there's the added benefit of they're cutting out a smaller tumor, or maybe nothing, and they're just taking that tumor bed. So it made sense to me. And I was also of the mindset of chemo was the worst part for me, and I'm just getting this done and over with. So it kind of worked for me on multiple levels there. So I did chemo first this time. And it did, my tumor was imaging after chemotherapy. My tumor was absent. I did have some enlarged lymph nodes still in my armpit, but I just had my COVID vaccine a couple of weeks before. So there was some confounding factors, and I was very adamant that I didn't want to have a lymph node resection again. So have all of my lymph nodes taken versus a biopsy. So I fought really hard for myself, because the plan was if I had an enlarged lymph node, they're all going because we're assuming it's cancerous during surgery. But I fought for myself to have it biopsied during surgery.
Okay.
And they actually did a preliminary assessment on it during surgery. And as long as that came back clear, it was just a biopsy. And it did. So I just got to have a lymph node biopsy in my right armpit. And I had a lumpectomy on the right breast as well.
Okay.
Yeah.
So I think it's important to mention here, your tumor on the other side, so the tumor you have now compared to what you had earlier, they were different.
Yes. So it was an invasive ductal carcinoma like the first, but this was a triple negative. So there was no hormone receptors.
Right.
Yeah.
And generally with those, triple negatives tend to respond quite nicely to neoadjuvant chemotherapy. If they're going to respond, they're going to respond really well, and unfortunately there are some that don't respond. And it sounds like yours responded quite nicely.
Yes, it did. And my protocols were slightly different the second time as well, because there are some chemotherapies that have a lifetime sort of maximum. And I had already met that the first time around. So I did have a different chemotherapy the second time around. Whether or not it would have been different had I not had the first cancer, I couldn't tell you. That was up to the oncologist, but there were some differences there.
Yeah. So what are the odds of having one, 23 and then another almost like not quite 10 years out? And still, did they do a genetic test again?
They did. And there were more genes assessed the second time around, and again, negative.
Nothing.
Yeah.
She's a unicorn.
Yeah.
Yes, I've heard that term before,
You
unfortunately.
don't want to
Yeah.
be a unicorn.
No, you don't want to be the unicorn. It sounds pretty and magical,
Yeah.
but it's not
My
pretty and
husband likes
magical.
unicorns. I'm like, unicorns are not
No.
good. It's not a good place to be. Interesting. Yeah.
Yeah.
Now, your lymph nodes, you mentioned that you had a total
Mm.
resection on your left side.
Yes.
Did you get lymphedema?
I didn't. I've been very lucky. I do notice that, you know, in a hot tub or something, I may have very mild swelling in my left arm if I'm in there for too long, but I've pretty much been free of lymphedema, and I'm very lucky for that.
That is
And
amazing.
I was worried that I wasn't going to be as lucky a second time. There were more plans in place though, actually to have a plastic surgeon come in and work on, I don't know, I didn't end up having to have it done, but
Mhm.
work on probably anastomosing lymph ducts, veins
Okay.
to
Okay.
really,
Yeah.
to make sure that that would be less likely to happen if
Right.
I
But
had to have another resection again. And they
right.
even offered to do it on the left if I was having issues.
But you weren't.
But yeah,
Right.
I didn't end up having to need that. So I did also have another surgeon in the wing ready to try and improve the outcome for me if needed.
That's good. You know, I just really, one thing I want to mention is in Alberta here, we are really blessed with amazing, like we have great breast surgeons. We have, like I've been doing this for over 20 years and most, if not all of the, staff that I've met, the physicians that are in the breast imaging, breast cancer field are really incredible and good at what they do. So it's kind of like, well, who should I go to? Well, they're really all good.
Yeah.
And Alberta is, we are ahead of most provinces too in terms of what's available to us, even in terms of imaging and all that.